Welcome back to Fresh Outlook. We are talking about the situation in Nepal and the devastating earthquake that struck that nation back on April 25th, and an aftershock that struck with almost equal devastation this week. Let's turn to Gary from Save the Children. Talk to me about the stewardship of the funds, the money that's pouring in, the people who are trying to help, and where that money's going, and is it being utilized effectively?
Right. Save the Children, other NGOs set up designated appeals, which means a person who gives money for Nepal, that money goes to Nepal, it supports the logistics, it supports the temporary learning spaces, the shelter. Everything that's needed for that response is managed out of an appeal. It's not used anywhere else. And funds are tightly controlled, we're audited. We have people who know how to manage emergencies. Sometimes people will give us funds that are designated for education. It goes to education. Obviously, we need supplies, logistics, security. And Nepal being a landlocked country, it does cost more to get things into the country. Always we try to buy things locally. When there's a pipeline, get it in country, get it distributed quickly.
Because also the money goes back into the economy that way as well.
Absolutely, that's really critical. You want to restore people's livelihoods. I know one of the early things we've been doing, Save the Children has been distributing rice seedlings. We want people to be able to stay in their communities, rebuild it.
Because you're saying the people make their living there as subsistent farmers often.
Outside of the urban areas, most people raise rice, raise crops up in the higher hills.
Whatever
potatoes,
they need to live.
Whatever they need to live.
Let's turn to KC for just a second. I've always heard after devastating situations such as this, the people who die weeks, months afterwards often is exponentially higher than the people who were initially killed because of disease. Tell me about the health concerns now. Contaminated water, no sewage system, these kind of things spread disease rapidly, right?
All very, very important points, sure. The most valuable immediate relief commodity that can be provided in any disaster, natural, technological, or otherwise, is potable water, right? So the first thing we want to ensure is that potable water is available. We also want to monitor.
Is that being done, as far as you know?
It is, it is, but in a disjointed fashion. You know, there have been shortages, and they're being addressed as they occur, but it's certainly an ongoing problem, as is the provision of sanitation. You know, when you have these refugee populations living in close proximity to one another, like in these camps, in these tents, it provides a very rich environment for the communicable diseases to be spread, particularly respiratory diseases and diarrheal diseases. When people aren't eating, drinking, and sleeping as they normally would, their immune systems are suppressed, and that only further exacerbates the communicable disease risk.
Dysentery, those type of things come into
Exactly right. Things like cholera, things like hepatitis that are spread through fecal-oral route when there isn't proper sanitation and when fresh water is not in abundance. We see these things happen.
Is the government doing an effective job in managing the relief situation there?
The government certainly doesn't have the capability that we are accustomed to in the developed world.
Is it because they don't have the financial resources, or is it because they have a lack of concern?
I don't think they lack concern. You know, I was brought in 2 years ago to work with the Ministry of Health to address their disaster preparedness, particularly as it relates to tectonic and seismic events like these earthquakes. So certainly it's been on their radar, certainly it's been a concern, but they not only don't have the money, they often don't have the expertise to develop, you know, more substantial plans for when these things happen.
Is this a third world nation?
You know,
I know there are no defined groups necessarily, unless you're extremely desperately poor, then we know you're third world. But this is teetering on the
it's a developing nation. That's right. That's right. And so their problems and their concerns are different than those that we have here.
If it struck China or if it struck the United States. Let's turn to Jolly, joining us from DC. Jolly, tell us about what you are doing to raise relief efforts for Nepal and where that money is going and how you hope it will help.
Yes, as soon as we heard about the first earthquake on the 25th of April, I, along with my team members, we immediately knew what to expect. We knew that this is going to be needed. We would be needing funds, and that's the most we could do at this point. So we started this campaign on Indiegogo, and luckily they transferred the Indiegogo funding to Indiegogo Life, where they have waived the platform fees. So till now, during these days, we've been able to raise funds in up to like $33,000, including the online funding as well as the fundraising events. So a small amount of this fund has definitely been gone to the hardest hit areas such as Sindhupalchok, Dolkha, Dhading, where 90% of the houses were gone. We have been working with few organizations in Nepal who are like grassroots organizations, and they've been distributing tents, water purifiers, water, and all these snacks and relief things in those areas. However, we never we didn't expect that our funding would garner so much attention and support from big organizations. I recently had a meeting with the United Nations Office of Partnership, the Secretary General Envoy's youth envoy, Ahmad Al-Landawi, and they have also given us a lot of support, and they will be helping us in future. We're going to have some fundraising events as well as concerts, as well as One Leader of Light, a very big organization which helps villages set up solar light bulbs around these areas. They just give trainings to these villagers, and they have this free of cost solar lights. Yes.
Okay, thanks.
So that's
giving us
wonderful.
A great overview there. Thank you. I want to turn back into the studio now, Dr. Bart Rossi. Dr. Rossi, tell me about organizing a mental health approach, a need that needs to be fulfilled and met as well.
Yeah, I mean, this is of a magnitude that we probably haven't seen before, something like this. For example, like, how are we going to take care of the kids or the women who are pregnant, other adults, other problems? It seems to me that we need a systematic mental health approach where we can get crisis workers to the right people. It has to be an organized approach. It has to be very systematic. And in a situation like this where there's chaos, it's going to be very difficult. I mean, I do a segment on mental health in America where we have all these resources. This is mental health in a situation where we don't have the infrastructure now, we don't have the resources. So we need some people who are very talented in organizational skills so we can get the crisis workers to these folks, help the kids, help pregnant women, and really make a difference. It's going to be hard.
Children are the most vulnerable in this situation?
Kids are the most vulnerable because, they're not going to be able to get themselves through the day even. You know, adults are going to have problems doing that. Kids are going to have more issues.
And Gary, I guess it's the same with medical issues as well and concerns, that the children are the most vulnerable, hence Save the Children. Well, talk to me about your organization for just a second. I always thought of Save the Children as more of a long-term thing, such as building schools, but not an emergency response. But apparently you have a double-barreled approach.
Save the Children does both.
Okay.
Like when I worked in Nepal for 7 years, it was a development program. And we built schools. Some of the schools in Gorkha, like the other 5,000 schools, need to be rebuilt now. But it's education, it's agriculture, it's teaching people about the environment, but a real focus on health. Save the Children has worked very closely with the government of Nepal to improve care for newborns, because most newborns in a village are born with a midwife in attendance because they're 2 days away. But we do both long term, and when an emergency strikes, we ramp up and bring our worldwide resources to supplement the excellent work of Nepali staff and Nepali partner organizations, of which we have many.
Right now, what is the number one need that Save the Children is fulfilling on the ground in Nepal?
Health. Healthcare is number one. Shelter is number two. And absolutely clean water and sanitation, hygiene kits. We want to prevent those diseases that were just mentioned before. I was in Haiti. We addressed the cholera epidemic. We do not want to see that. That would be devastating in a place like Nepal.
Casey, we're coming up on our last 2 minutes. I'm going to let you close this out by talking about what's happening on the ground, what needs to be done, and what the future is for Nepal. From your perspective, you're a medical physician, you're an emergency management expert, you're a professor, you've been to Nepal, you've worked with government relief officials. Tell me, if they brought you in there right now to tell them what needs to be done, you're the dictator. Tell me what needs to be done.
If only it was that easy. There was a two-pronged approach. Obviously, we have to meet the more immediate needs. And most of the disaster relief efforts that are occurring, They aren't occurring in a universal, organized fashion. It's difficult to do that. You know, there are many ad hoc attempts to address these issues as they come up from different organizations. But you know, a more organized effort would certainly be advantageous. But you know,
is there a lead agency? Is it the government? Who is that? Who organizes this effort?
It's the government that has to.
Right.
You know, they'll get plenty of resources available from other governments, from NGOs, but ultimately it's the government that has to step up and provide the leadership. Unfortunately, in Nepal, you have a situation where the government is not a very strong one, and it's quite tumultuous. And as a result, not only as it relates to disaster relief, but all government functions don't occur at the level that we are accustomed to here. That handicaps them. But the most important thing to remember is that while we have this immediate crisis to address, that most of emergency management, the vast majority of emergency management, takes place in non-disaster times. This will happen again. There will be other catastrophes that hit Nepal. We certainly know as a result of their, you know, location, the seismic and tectonic risks they have. And so, on one hand, we certainly have to deal with the situation as it presents now. But more importantly, frankly, it's to think ahead. It's to analyze, do the lessons learned, figure out what worked and didn't, and come up with a better strategy to address future disasters.
And it seems like nobody wants to do that. It seems that people want to deal with the crisis at hand because they see the suffering, and then they leave for tomorrow what will happen tomorrow.
Unfortunately, the stimulus for many international disaster relief efforts are those things that happen after a crisis. You know, that's when people get attention, that's when money rolls in, and it's an ounce of prevention worth a pound of cure, rather than a pound of cure sort of thing. You know, a simple emergency management strategies employed early on ultimately mitigate situations far better than once they occur.
Lessons for the United States as well.
Sure.
I want to thank you for your time, Casey from Adelphi University, Gary from Save the Children, and Jolly joining us from DC as well. Thank you. Bart, you're going to be back with us. We'll talk to you more. We're going to talk about the new war on poverty. Is it happening after this?